Hey, we're here with our favorite St. Louis functional medicine doctor, Dr. Seth Gerlach from Core Health.
Hello, thanks for having me.
So he's going to talk a little bit about functional medicine, let us know what it is and how it's different from conventional medicine.
Yeah, so functional medicine, it's a new way of thinking about healthcare, medicine all wrapped into one. It's been around for a couple decades now, but it's really starting to gain steam because, the problems we see today, they're so complex and they're so different than what we saw, 50, 100 years ago. So functional medicine, it focuses not just on the symptoms and not just on covering up those symptoms, but getting to the root cause of the problem. And those root causes are many, we can get into those, but that's what really sets it apart. And not only that, it's not about getting people healthy, for another day or helping them feel better. It's about helping them to get healthy and stay healthy for a lifetime. Because we know, like I said, the problems of today, they're killing us at a record rate. 7 out of 10 people will die of a chronic disease like cancer, cardiovascular disease, diabetes. But these things are so complex, they have more underlying factors of them that can't be fixed with a pill.
What makes functional medicine different than conventional medicine?
So they're a lot different, actually. So conventional medicine is really focused on name it, blame it, and tame it is what I say. So they want to find some kind of condition. It's what is the disease? And then blame it, so all your symptoms are due to this, and then tame it with some kind of drug, medication, surgery, whatever it may be. Whereas functional medicine it's more about why. Why do you have this in the first place? What's causing your blood pressure to be high? Why are your blood sugars off? Why do you have autoimmune disease in the first place? So in order to figure that out, you have to do some deep testing and figure out that why, the what we call the root causes of that. And so conventional medicine, I use the analogy of you get up in the morning, you get in your car, and you're going to work, right? You back out of your driveway, and your check engine light comes on. So you take it to the mechanic, he puts it up on the lift, and he goes in and says, I know what your problem is, your check engine light's on. So I'm gonna go ahead and take that off for you. So you get off, drive off. The next day you get up, you back out of your driveway, the check engine light's on again. Take it back to that same mechanic, puts it up on the lift, says your check engine light's on, let's take that off. How many more days would you keep going to that same mechanic? That's kind of the same thing we deal with every day. If we wake up, we take a medication, or we go to the doctor and we're just covering up symptoms with medications. So the functional medicine doctor would put that car up on the lift, run all the diagnostic testing available to find and fix what's going on with the car and what's going on with your body. Because a lot of people want to know, why am I having this? I don't want to be dependent on drugs or surgery the rest of my life. I want to figure out what's going on with me. That's where conventional medicine shines too. It's not about, functional medicine, it's not about keeping you alive for another day. Conventional medicine's great at, keeping us alive to fight another day. If we need emergency surgery or a broken leg or things like that, we're awesome at that. We're not so great at keeping us healthy for years and decades down the road. That's where functional medicine really shines, because if you fix the problem, you can get someone healthy, educate them so they can stay healthy for a really long time.
And creating more of a quality.
Exactly, and it's quality of life, and it becomes cost effective, down the road, not only in the short term, because if you're not relying on doctors and medications and surgeries, and you don't end up in a wheelchair in a hospital the last 5-10 years of your life, how much is that worth? Right.
So who would come and seek out a functional medicine doctor, and what would the typical treatment plan look like?
Yeah, so we see a lot of different kinds of people. The large majority of people, they've been to conventional medical doctors already. They've tried medications, they've tried other therapies, and they're not seeing results. They still don't feel correct. A lot of people come in, they say, I've been to my doctor, I told them all my symptoms, they ran a couple tests, and they came back and said, your tests are normal, it's probably in your head, let's give you an antidepressant. How many of you have heard of that? You guys probably hear your clients say that all the time. But all these people, they know something's wrong, something's off, I don't feel correct. So people with thyroid conditions, this is overprescribed. This is the number one drug prescribed in America is levothyroxine or Synthroid. And it's really misdiagnosed too. And thyroid conditions, there's so many different things that can cause a thyroid condition, from blood sugar infections, hormone imbalances. So, and that's where functional medicine is great at finding the cause and fixing that. Other things like autoimmune diseases, just because you're taking a pill for an autoimmune disease to cover up, if you have joint pain or gut symptoms or brain fog, you're still not turning off a mechanism, because autoimmune diseases, they always have a trigger. It's not like just because you have the gene you have autoimmune disease. There's always something that trips that switch. So it's important to turn that off so you can get healthy and stay healthy. Other things like
So wait, before you
Yeah.
go on, so you're saying that even though I may be susceptible to a thyroid condition, I can turn that gene off?
That's correct, and that's the neat thing about health in general. You guys work with this too. A large majority of our health, over 80%, some people say 90% of our health is not due to our genes, but what we do, our environment, how we eat, how we sleep, how we exercise and de-stress. So you can turn genes off or on with what you do every day. It's profound, Same thing with autoimmune disease. You can have the gene, but you also must have other factors that turn that on, and your immune system must be abnormal somehow to make that and keep that
We
going.
believe that gut health is really important, and I see a lot of people in my office who are suffering from different types of digestive issues. But I also think that many other chronic diseases stem from an imbalance in the gut and gut health. So I know you focus on that a lot here. What other conditions do you feel are directly attributed to gut health?
Right, good question. So many diseases, conditions, whatever you want to call it, are tied directly to the gut. Almost 80% of our immune system's in our gut, so if we know if our gut is malfunctioning at all, our immune system is off too. So some of the conditions would be thyroid. Most people don't know the thyroid hormone that we make has to be converted into usable form. A lot of that happens in the gut. So if our gut's inflamed, we have infections, things like that, we could have thyroid problems. Another thing would be any kind of brain disorder at all. So we know the gut and the brain are connected. They're from the same tissue when we're in the womb. And so they're still connected later in life. So if our gut is inflamed, our brain is inflamed. So we see this a lot in autistic individuals, even anxiety, depression. We know a lot of our neurotransmitters are made in our gut. So if we can't make these neurotransmitters correctly, we're going to have problems in our brain. We're going to be more anxious. We're going to be on edge. We're going to be irritable, things like that. And even new studies show that Parkinson's and Alzheimer's can begin in the gut too. And it's not just these. You can tie almost any condition, disease, whatever, to the gut, because the gut's kind of a reservoir for the whole body. So if we have an infection in our gut that we don't know about, the immune system's constantly tripped. And this is when we can have certain things like brain fog or joint pain, or even autoimmunity can start from things like this.
So how do you treat that?
So what we do in functional medicine, we don't guess, we test. So no matter what we're doing, we're finding the specific cause of the person, fixing it. So a stool test is imperative to find out what's going on in the gut. That'll show us if there's an inflammation, if you're digesting the food correctly, if there's overgrowth of bad bacteria, because we need a good amount of good bacteria and a little bit of bad, and they're kind of imbalanced. We don't want an imbalance though. Or things like parasites. All these things can really trigger that inflammation, that immune response. There's also certain tests called organic acids that really test other bacteria in our gut, but also test, if we can detoxify our neurotransmitters like we talked about, and if we're using energy correctly too.
Well, thank you for your time.
Thanks for having me, guys.
Thank
This
you.
is great.